This conference will now be recorded.
Good afternoon, everyone. Good morning in Latin America. Good night to our Asian members. Thank you for joining us today. Before starting, we kindly ask everyone to mute your microphones, of course, except for the speakers at the time of their corresponding intervention. If you have a weak connection to internet, a good idea is to turn off your cameras. Otherwise, we are also happy to see your faces. May I also remind to all of you that the chat function is also available should you want to raise questions and comments. We will keep track of all of them during the conference, and that will help us to optimize our time. We are witnessing unprecedented times. We have been forced as business organizations, as business community, but also as individuals to work in a completely different manner. And there is a big call from different sources to act responsibly, to act in coordination, and also to act quickly to anticipate the risks and also the challenges that the COVID-19 crisis is giving us. This is the 6th digital conference of a series of conferences that we as the International Organization of Employers, as this big network, the wider network of business, is organizing with relevant stakeholders on this matter. We just want to have, we don't want just to have the conference or the exchange per se. What we want is to identify action which can help not just our members, but also the societies in general. Also, our goal is to share with the business community the latest information on the evolution of the virus and to discuss about best practices around the world. The topic for today is the private sector contribution on health emergency situations. COVID-19 continues to spread across the globe in a rapidly and life-threatening situation. I have repeated that, but I will continue saying it. For business and for business organizations within the IOE, lives are the top priorities. Health is the top priority. This pandemic is disrupting also in an unprecedented manner the daily life of people and businesses. Today's conference will address the relevant questions. Some relevant questions such how international organizations, especially WHO and ILO, and I want to thank both speakers today for the effort that they have made to be with us, the representatives, the high-level representatives of WTO and also ILO, also with short notice, and that says a lot, and also with the busy schedule that they have during these days. We would like also to know better how they are currently working with the public and private partnerships in response to the COVID-19. What kind of initiatives or campaigns have been launched thus far? What levels of engagement and support have been received? How can we help as business networks, as individual companies, to reverse the situation? In preventing future global health crises, how they can further promote and strengthen with us private and public partnerships, especially in developing countries, to tackle the health-related issues and to improve overall public health care systems. What we are witnessing now as IOE is that the situation in many developing economies, especially in Latin America and in Africa, and we have many participants coming from these areas of the world, needs critical guidance, which is not always so available. For these purposes, we have the honor of counting with the participation of high-level experts, and I refer to that, of the Director of Public Health from the World Health Organization. We will listen to the interventions of our speakers, and then we will dedicate some time to answer the question that you send via the chat function. I have been told that our speaker from international source, guest speaker, will have to leave before the end of the meeting. So please make sure that questions directed to him are sent during the speech, so that we can tackle them. Also, we have the honor of counting with the Director General of the Chilean Chambers of Commerce and Production, Mr. Fernando Abear, who very kindly accepted yesterday night, I have to say, to join us because they have a very interesting contribution that they have set up in Chile precisely to help and support the health sector in this country. Without further delay, I will call Dr. Maria Nera, Director of the Department of Public Health from the World Health Organization. Dr. Nera has a very extensive curriculum, so I'm not going through all of it. You can see it in the screen. You can see part of it in the screen of what she has done, but let me highlight that she has wide expertise in the control of health emergency situations like the one we are living these days. For our members, the perspective of the health authorities' expertise on how we can contribute, but overall how to assess and when to react, timely measures, is one of the most relevant and difficult questions that business face today. Since there is no way to contain the pandemic without a major impact on the private sector and the economy in general. What is the role and what does the company's management have to look and be attentive at in these situations? Disruptions also in supply chains is a consequence of the containment measures that are being taken. What are the needs and recommendations from a health needs perspective? Maria, thank you very much for joining us today. The floor is yours. You have, as we agreed, 15 minutes, but we are flexible on that. Thank you so much.
Roberto, Maria Nera just left. She was connected, but she just left.
Let me connect with her via WhatsApp to see if there's anything wrong.
She's back. Good morning, she's back.
Maria,
Yes.
can you hear
Now
us?
I can hear you. Sorry, I had some problems with the audio. Here I am.
No.
Sorry.
No worries, no worries. We were just introducing your intervention. We were referring also, we were also thanking you for the effort we made in such a period. And we were referring also the approach that we need from you also in terms of how we can do better as a private sector in these health emergency situations. So the floor is already yours. You can start if you're ready.
Thank you, Roberto, and thank you all. I understand how important is this meeting, so I'm very pleased to be here, even in these very exceptional times. It's really an incredibly historically unprecedented situation, and that is why I think we need to all show something exceptional in those difficult times. Definitely the contribution of the private sector to this has to be very creative at the level of the needs we have at the moment, and we count on that from you. I'm sure it will be an important and critical moment. The private sector can play many roles on this one, and we would like to share with you some slides that we have prepared just to introduce a little bit the topic, and then hopefully having a very interesting discussion. I'm not sure whether
Marina,
yes?
I think she case. Marina, is she handling the presentation?
Yes. No, they asked for the presentation to be handled, so I made her presenter. So you can just open your PowerPoint, or if you prefer, I can also do it.
Yeah, because I don't see it at the moment. So if you can do it for me, it would be better.
Yes,
thank you.
No problem.
You just have to say next slide every time that
Yes.
you want to change.
Yes, I will. Thank you. Okay. Well, let's have the next one, please. Okay, I'm sure I don't need to walk you through this because everybody's listening the news. Every 2 minutes they are giving us different updates, and how dramatic is the situation getting at the moment. We are approaching 500,000 cases globally, and probably what is the most critical one is that at the moment it took us several days to reach, more than 67 days to reach the first 100,000 cases, and since then the number of cases is multiplying and very quickly. You know very well that at the moment the epicenter of the outbreak of the epidemic of the pandemic is in Europe, and unfortunately Spain is one of those most heated countries in Europe, together with Italy. And then we know that probably soon that the epicenter will be moving to the United States, and Europe needs to be prepared for the next days, which will be probably very critical. Next one, please. So this is accelerating very much. As I mentioned before, it took 67 days from the first reported cases, and now we see an increase. To give you an example, in the last 3 days, the number of cases increased by 100,000% cases. It's true that all the countries are doing massive tests and proactively looking for the cases, but what is critically important, and as I mentioned before, totally unprecedented, is the fact that we have at the moment billions of people, and the number is increasing every day, who have been asked to stay at home. And we have entire countries which are totally locked down, and this is representing a situation that we have never seen before, even in the most dramatic public health challenges that we have been facing. This has never happened before. So this will require a completely different approach, and creativity, innovation, contribution, and solidarity. Next one, please. Well, you know that we have been looking at the scenario. We look at that no reported cases, sporadic cases, cluster of cases, and community transmission. And you can see here the type of measures that we are recommending, depending on where the countries are facing the scenario number 1, the scenario number 4. Unfortunately, at the moment, in the countries in Europe, the ones that we were mentioning before, they are on the community transmission, and they all have moved into those very restrictive and lockdown measures that we have been recommended. But as you can see, this slide, I think, is still very valid, particularly for those countries where they are still not reporting cases. Unfortunately, there are less and less now, but there are countries where they are still reporting sporadic cases or cluster of cases. I'm thinking in Latin America, for instance, or Africa, where we can provide good recommendations based now on experience gained painfully by other countries. Next one, please. So this is clearly a call for a collaboration between employers and workers. They have a very important role to play, and from WHO we will be very happy to create a frame to collaborate on that, obviously with our colleagues from ILO that will be talking later. But we are convinced that we can stop or contain this virus and reduce as much as possible, or minimize as much as possible, although what we are seeing now gives very little space for hope, but we need to create that hope on minimizing the impact on the economy and the society of this disease. Next one, please. The risk associated with the COVID-19 is that we have seen now at the moment a high absenteeism due to, in some cases, because of the containment measures, or because the disease prevalence, and the workers have been requested to be at home on quarantine. And of course, we see that sometimes the working place can amplify the transmission of the disease at work. Next one, please. On the other hand, we are spending a lot of time, and I'm sure that all of you have been dealing as well with this issue of what we call in WHO the infodemic. There has been an incredible amount of rumors, myths, misinformation, nasty informations as well that have been circulating and creating a lot of damage and contributing as well to this situation where we have kind of panic and unnecessary disproportionate measures sometimes, and chaos. We saw we all remember those horrible images of supermarkets totally on assault by consumers, thinking that they will miss food, and we can even anticipate other social disturbs or unrest that could be happening if we don't stop this infodemic, those rumors and these unnecessary sources of information that are causing damage in terms of this panic and terror on people and fear that will provoke very unreasonable and disproportionate measures and responses by the people, and creating a psychological damage as well, because we have at the moment all people staying at home, following the quarantine, but hearing permanently how much there will be the ones that if you need to take decisions about who will get support, there will not be selected and things like that. So we need to be very, very careful and not spreading this type of rumors, and not only not spreading it, but fighting against. Next one, please. I'm sure that by now you might be aware about this EpiWin, the WHO information network for epidemics. You have, the idea is to have reliable information that people can use at least once a day. What we are saying is that everybody has the right to use and have their own sources of information, but at least once a day you need to consult a reliable source of information and get the facts and get the information right. So we will definitely invite you to pay attention to this and consult this website in WHO at least once a day, which I'm sure is already the case. Next one, please. And here is where we start to talk about our business of interest on today. Get prepared. And if you are, I'm sure you are already very well prepared, but for those who are starting now, or for those working on those countries where they still have sporadic cases, get prepared. Go and develop a business continuity plan. Do it involving the trade union, involving the workers, involving the employers, and make sure that you have a plan B in case you have your workers that are on quarantine, and plan for a safe and healthy environment. By the way, investing on a safe and healthy environment will be a non-regrets investment, no matter what, because you will prevent the spread or of the coronavirus, but you will as well invest on preventing many other diseases and creating a very safe environment for your workers, and that will be, as I say, a very smart and wise investment for the future as well. Next one, please. So there are two things that we would like to insist on it with you. One is how to prevent the transmission of COVID-19 between employees, sorry. And in fact, I would say prevention of the transmission of the SARS-CoV-2 between the employees. Very reasonable and I think common sense measures. The first one are aiming at preventing the transmission between the employees, and therefore you do that by physical distancing, implementing remote work practices, teleworking whenever is possible, not always is possible, social distancing measures in the workplace, and 1 meter minimum, fewer people in elevators, or reduce the face-to-face meetings as much as possible. So those are very basic measures that, if applied correctly, we can contribute enormously to reduce the transmission. At the same time, we need to reduce transmission from people outside the company, and we need to restrict the number of visitors entering the workplace, or limit travel beyond non-essential, which is now I know that nobody's traveling, so that will be almost irrelevant. But in some countries, they are still traveling. And then we need to be very attentive at detecting possible cases as soon as possible, taking the temperature of the employees, having facilities for that, and making sure that if they are positive or they have fever, they should stay at home with their contacts, and ensure that people with symptoms will stay at home and quarantine themselves for 14 days. Next one, please. Obviously, the employers are frontline responders. These days, we are all talking about the health workers and how much the role they are playing is critically important for the society, but the employers are frontline as well in terms of the response that needs to be provided, because you will create the environment where the working environment where the transmission will be reduced as much as possible. You will be the one providing the essential services, and you will be the one very much concerned about the economic consequences and the social consequences that this pandemic will create, and anticipating that and hopefully supporting as well to minimize those consequences. So you need to help your workers to have access to the most possible reliable information, and for them to understand what is the disease about, what are the systems, the symptoms. And again, the disease is a respiratory disease, it's not a disease transmitted by other ways. So the measures can be very simple with this, I think have been described everywhere on the respiratory etiquette, the hand washing, self-isolation of the sick. It's true that in some countries like India, I'm wondering how we will be facilitating this hand washing in places where there is no soap or no water and people live in very difficult conditions. So that will be a big challenge where we need your support as well. Next one, please. Well, at the moment that, you know, the workers who face the greatest coronavirus risk, we have the health workers. You probably heard what's happening in Spain and in Italy, where we have an important percentage of health workers who have been infected, and this is something that obviously proved that the barriers to protect them were not in place at the beginning, or hopefully they are now. And you see in this pyramid which type of workers are the most exposed one, and therefore that will invite you to take reinforced measures to protect them according to their potential risk and exposure. Next one, please. You need to maintain a safe and healthy work environment. And as I say, this is no matter what the moment we are living on is. It's not because we have a pandemic. It would be ideal to have a safe and healthy work environment. It's a good investment anyway. But in this case particularly, we need to make sure that there are hand washing information and training to employees. Again, it's something that is incredible that in 2020 we need to still tell people how to wash their hands, but it still remains as one of the most basic and fundamental measures to prevent the spread of the virus. Clean workspaces, and frequently including high-risk areas, space in places where we need to open doors or elevators, buttons and things like that. We need to provide a good cleaning facility. Antiseptic gel or washing hands stations, because again, it's just a question. With soap, you can perfectly kill the virus, and this is exactly what we want to do. Kill, no, because he's not alive, so we don't kill him, but we destroy him completely. And then establishing a reporting system in case there are, I mean, if I feel that I have symptoms, what do I do? And the system has to be well established for reporting. A system for quarantine of the close contacts as well. A basic recommendation as well, good ventilation at the premises. Food delivery, if possible, avoiding close contact, at a food delivery system without contact with the food deliverers and avoid employees to have contact with them. And very, very important, but probably one of the most the most neglected one, which is the psychosocial support for employees, and I will say for employers as well, because these days I think we all need some social psychosocial support. Next one, please. Okay, what are the WHO resources for employers and workers? I think you have you can access all of those. We can provide all of those links, and all of this information is in WHO, of course, at your disposal. Hopefully it's useful, but I think you have responses to almost most of the questions that are called today, that are asked today. You have different material and different responses, and if it's not the case, we can maybe together identify what are the gaps that we still need to fill. Next one, please. Challenges, well, there are so many, but one of them is, I'm sure you are very much aware, is the loss of pay for hourly workers. What do we do about that? How we ensure equitable access to healthcare and health insurance? If we talk about Europe, the situation is one, but if we talk about other countries outside, the challenges will be definitely bigger, and we need to anticipate that. One of the big challenges is as well how to protect the informal workers or subcontractors. You cannot keep telling those working outside on the informal sector that you need to flatten the curve. If they are starving, I don't think they will respect that recommendation, and in a way or another, they need to get out to make money to eat, fundamentally. So we need to be prepared for that. How do we engage and collaborate with unorganized workers? They are living on an informal economy, and including, for instance, the domestic workers. And we need to use modern technology to maybe control and deliver occupational health services. It's the time to prove that technology is there to help us and to support us and to serve us. Next one, please. I wanted to show you that you are certainly already aware, but this is the joint statement between WHO and the International Chamber of Commerce that our Director General had an engagement and a discussion with them, and this is definitely an unprecedented private sector call to action. We are convinced that the private sector will be one of the most important contributing to the response, rather because you will change your line of production and you will contribute to develop and produce protective personal equipment or masks or whatever is needed. I think we were all following with a lot of interest and admiration this quick development of ventilators with the 3D technology in Spain. So creativity will come from the private sector as well. So we need desperately your help, and I think is the question of the economy of your country needs as well desperately your help, particularly to make sure that there will be a future after COVID-19, which it has to be. So we need to start preparing for that, and I'm sure that this public-private collaboration this time has to be the most creative one and strategic one than ever. And the next one, please, which is, I think, the last one, is WHO and the UN Foundation and partners have launched the first of a Solidarity Response Fund. This is quite unprecedented as well for WHO, because normally we are very restrictive on the way we receive money, but this is a fund to help those countries where the health systems are very weak and they desperately need support. We are all on this, so there is no point on having some countries responding in a very good way if we cannot all do the same and stopping the spread of this virus. I think this is the next one. Next one, please. I think it's just to say thank you so much and appreciation of this opportunity. Happy to participate on this and creating maybe on a more formal mechanism for establishing this cooperation. And more than anything, creating a kind of platform for creative and even crazy ideas. This is the time for crazy ideas. So if somebody has crazy ideas that will contribute to solve the situation, I'm sure that those will be very, very much appreciated. Over, and thank you very much.
Thank you so much, Maria. It has been very, very comprehensive and very useful. May I just, before we go to Laurent, I'll raise the questions that are foreseen for you, because there are several ones, so I want to package them, and then we go to the following speakers, and so that we'll have a better interaction. So yes, one previous remark from my side. It's really great that you are starting to formalize the collaboration with the private sector, and we as IOE, as the International Organization of Employers, are more than willing to have better and regular mutual collaboration in precisely in these areas. I mean, we have to realize, and that's important for you to notice, is that the members of IOE are the ones being consulted by the governments at national level on all the aspects. If I give you the example of MEDEF, of COE in Spain, of FED, of the BEF in Bangladesh, or ANDI in Colombia, I mean, those are the ones that really have an important say in terms of pushing the policy agenda when it's needed. So it's very, very important that as well as you have done an undertaking and collaboration with ICC, also we have an important one with the ones representing the employers and the ones that are consulting for employer matters. But and it's time also to act together, I think, in an effective manner. So I have several questions, but I'm going to gather them a little bit. One of them has to do with the balance between limiting economic stress and at the same time health. So meaning by that, when to what extent drastic measures are absolutely necessary, that's a common recurring discussion, and for us health is at the top priority, or to what extent these drastic measures will have consequences also on health on the middle and long term, and the other way around. I mean, we have seen several feedbacks from many business organizations saying that the drastic measures are very good because that will help to recover economically also soon. So this balance between the two areas is really tricky, but very, very important. And any insights from your side is useful. And we have several questions from some of the participants. Another participant referred to the lessons learned from the Ebola outbreak. I don't know whether there is any lesson that can be taken here. And also in terms of guidance, the problem that we have is the information that we often have is not reliable. I mean, that's a question that raised by our member from Venezuela. Venezuela has one of the weak public health systems in the region. Official information is not reliable. Independent journalists who report are detained. So what kind of support or communication do you have with the government to face this serious situation in the country? I have a last point is related to supply chains, and what we are seeing is that is very often the case that governments, even in developed economies, did not have access to basic needs for health systems. To what extent the role of the WHO could help to better channel the flow of basic needs for different countries, especially those that have now the peak of the pandemic and those which are coming now, which perhaps in Latin America, etc. So sometimes what we miss there is a global action instead of government by government trying to ask to any, by instance, Chinese provider for help in the supply chain. It's not just a question of cost, it's a question of resources and whether WHO can help further on that. So I don't know if I have been clear enough with the question. I forgot some of them, but I just wanted to at least have a package now before we go to the next speakers.
Okay, do you want me to try to address those questions now? If I understand correctly, yes. Hello? Can you hear me?
Yes, perfectly.
Yes, you want me to address that. Okay, I will start and maybe I will pass on the supply chain. I will pass it to my colleagues from Epidemic Preparedness and Response Emergency Team if they want to add something. I think the issue of the balance between the restrictive measures and the economic stress that we are that the pandemic is causing. This is obviously the balance we all need to maintain. There is not perfect formula here on what to do. You know, the thing is that this is a new virus. We saw the way China has sorted out the situation. I think we were all watching on television day by day the measures they were taking. Then we saw another model, which was the one in South Korea, the way they were doing it differently, and apparently they are now reducing the number of cases dramatically, so probably they went already. There are, even in Europe, there are different models. You have, we are living here in Switzerland where schools are closed down, the business and theaters and cinemas that are all closed down, but you can still go out and you can still have some activity. And you have the model in Sweden now where they have decided not to take any restrictive measures. So I think this decision is one of leadership. It's clearly one of the most difficult one that as a public health, as a leader of a country, a government, you need to take. You need to balance what you need to do to contain the virus, to treat the cases, obviously, because there is one thing that is very clear, and on that one, I don't think there is any debate or controversy. You need to reinforce dramatically your health system in order to treat those severe cases, and that's is a must, because those cases are happening. So, and that creates a lot of fear among the society, and obviously you need to treat your patients. But at the same time, you need to have the other strategy, which is a government strategy. It cannot be only public health. It has to be the whole government, all the sectors of government involved in putting all the elements on a balance and deciding which measures. Obviously, health will be at front, no doubt, but at the same time, you need to look at what are the measures that will respond to your specific risk assessment. And this is where you need to be very, very you need to take very strong decisions and very difficult decisions, but at the same time, you need to do it without any media or political pressure or citizens' pressure. You need to do it based on science, you need to do it based on experience, and you need to do it based on what have proved that it works, and looking at maybe the focus and the places within your country where you need to take very bold decisions. And this is something that unfortunately we don't have a formula and saying, okay, do this exactly, and no matter what, if you will destroy the economy, this is exactly what you have to do. No, it corresponds to the country, to the leaders to take that decision, and we can provide advice on what are the measures that will contribute to contain the virus, but then how far you want to go, or how far you need to go, and how far you need to prepare the society as well for taking measures based on science and not based on panic or based on fear or based on the way that you are receiving a lot of pressure and then you have to do it because others are doing it. So it's a horribly difficult and decision, but it's where you show leadership. I mean, there are exceptional situations in life where you need to prove that we can respond to those exceptional situations. If there is a non-regret investment that I would recommend, is investing on your hospitals and your healthcare facilities. That for sure, no matter what, is a good investment, and will last, and will, you know, after the outbreak, you will still have something that investing on your health professionals and your health system completely as a whole is a good investment. Now, the sooner you start to prepare for the recovery, for the next phase, for the how to recover the economy, how to start to plan on how to mitigate the way the economy will be destroyed, how you start to inject financial support in places where you need to do it in order to start to prepare for the future, the better. And I understand that there are countries that are already doing that plan, but the sooner the better, and then the collaboration of the employers will be fundamental. Because, as you say, I mean, if we do not recover properly from an economic point of view, the health systems will suffer as well. So somehow we need to, that is something that the employers needs to be involved from the beginning as well, on working on what next and how to start to put all the basis for the recovering of the economy. On the supply chains, and that there is a need for maybe a more global action. WHO is supporting through the Solidarity Fund, is supporting and coordinating the supplies that needs to be sent to countries on difficulties. But maybe my colleague Ivan or Sarah, do you want to comment on that?
If you allow me, Maria, we can give the floor to Ivan after at the end, because we have the next speaker that needs to leave at 3 o'clock.
Okay.
And it's a very interesting topic. It's a very interesting topic, supply chains, basic needs. So we go now to Laurent, who is waiting, and we'll come back to the supply chain. Thank you very much for your feedback. We keep exchanging now. Laurent, you have the floor.
Thank you, and thank you, Roberto. Thank you, Maria. Very interesting presentation from WHO, and I think it's really relevant to what's happening. It's extremely relevant. The WHO website is a source of fantastic information, and I really would encourage you to look at it. And as Dr. Nera explained, what is key is preparation. So next slide. International SOS, we're involved all over the world. You can imagine we have clinics, we have assistance centers, we do a lot of medical evacuations. We are on the ground all over the world. And next slide, please. This allows us to actually see. This allows us to actually see. This allows us to actually see the impact per region of the pandemic. So, of course, you can imagine the initial impact was in Asia. The next impact is in Europe, and as Dr. Nera says, and it's going to be the USA, and then Africa and South America. And the impact and the way that the strategies that different countries use are going to have varying levels of impact, or varying levels of efficiency. Yesterday, WHO actually edited a 6-step plan to eradicate coronavirus. And coming from the premise that lockdowns and things like that, the only thing they do, and it allows us to buy time, to flatten the curve, and to find ourselves in a situation where the healthcare system is no longer put under such enormous pressure that they are unable to cater to even the basic medical needs of their citizens. Next slide, please. Now, companies, I can tell you right now, the major challenges are disruption, productivity, and resilience. So disruption, it will depend on which phase of the pandemic there is, but disruption is going to be disruption in business travel. You can imagine it's not necessarily going to be the health risk. It's going to be the logistical challenges. So initially in China, people traveling to China for business, they found themselves locked down. They found themselves in quarantine. They found themselves with canceled flights, and they found themselves with, they found themselves in situations that they were completely not ready for. When the coronavirus does hit, then it's a situation where disruption is actually disruption of business travel and disruption of business very clearly. Sales go down, production goes down. Some companies are very fortunate, they can continue production, but other companies, they can't because number one, they don't have enough employees because all their employees are sick. But number two, sometimes there are measures that are implemented by the regional governments that obligate that business to close. And that business continuity plan needs to take into consideration the impact, the economic impact that it would have of closure, but also the impact of not being prepared enough and finding yourself in a situation where you have to close all your offices. Initially, anecdotally, Nike, they have their head offices in the Netherlands, and one of their employees tested positive for COVID. Okay, the public health authorities didn't obligate, but the Nike company felt obligated to close their office and to send home their 2,000 employees. Now you can imagine the disruption that it had. Productivity. When you look at productivity, of course, you need production. If you're a service company, okay, it's going to have you're not going to be able to provide your services. But also, if you are a company and you have a back office or whatever, working from home has its unique challenges. I can tell you, as a remote worker working for International SOS, I've been doing this for many years now, and I'm used to working in the office and outside the office. And despite that, there are some unique challenges. Internet goes down, the web server, the mail server goes down, et cetera, and that productivity has really a toll. One of the things that I really want to point out is that productivity is also going to be dependent on the employee's mental health. And being isolated, being in your home office, away from your colleagues, even if you can have virtual conversations with them, that is really going to have an impact, because ultimately, if someone really nurtures or appreciates going to the office and meeting with people and having the commute that announces, okay, now I finished working and I can go back to my family, etc. They don't have that anymore, and it really will have an impact. And we're seeing it more and more. I work as a physician on the ground in Belgium. I can tell you that the number of mental health issues are in significant increase. And when we look at mental health and we look at non-communicable diseases in general, mental health being one of them, we see that the people that are most fragile in terms of non-communicable diseases will also be the most fragile in face of COVID, which is in itself a very important fact and a very important thing that we need to keep in mind. And then resilience. Companies need to also be resilient. They need to appreciate the risk, but they also need to appreciate that they need to stay in business to have employees and to be able to continue to produce. So resilience is a really big challenge. It's a huge challenge. Being able to build that resilience in face of the pandemic, knowing that we're probably not going to have just one wave. We're going to have 1, 2, maybe 3, maybe 4. It's going to last some time. We're not. Despite a very prominent figure saying that it's going to be over for Easter and everything's going to be all right, well, it's not going to happen. I think everyone sees the writing on the wall, and so it's very important to understand that you need to start building in resilience. You need to understand that you need to stay in business, and you need to work as you move ahead. Next slide, please. So one of the things that's really important to understand is there is, at every single level of the wave, and when I talk about the wave, it's the number of cases, the number of deaths, the impact that the pandemic has on a country and on a region, because it's not just, it doesn't have a border. It's the epicenter is right now is Europe, but in a few days it's going to be the US, and so that wave is going to have, at every single part of the wave, is going to have its unique challenges. In the beginning, it's going to be determining what kind of business can you still keep doing, accessing adequate information, accessing reliable information that allows you to inform your employees and inform the C-level suite so that they can make leadership-based decisions, making sure that the business continuity plan is up to date, making sure that there's a crisis management team, understanding that not everything is possible, and that that things will shut down, and that there's a highly dynamic situation, but understanding it as well that sometimes a last-minute deal would make or break a company or an industry. So understanding that there are in every single phase of the wave, there are unique needs. Once you get to a peak in the wave, of course, you need to start looking after your employees, because business travel is no longer possible, and the workplace does not exist. I mean, the workplace is actually everyone in self-isolation, or at the very least away from each other. And so the normal social norms will have its impact. So it's very important to understand that you're going to have mental health needs, and you're also going to have organic health needs. And mental health and organic health sometimes can be managed from afar, and that is probably the most that's the best solution. And being able to provide that to your employees will help in terms of employee retention, but also will help in terms of making sure that a bad situation doesn't become worse. And then understanding as well that when the peak goes by, you need to get back to business, and you need to get back to business. It might actually be a determining factor for your business, because it's also going to be an idea that you can make or break. Understand that some companies, the faster you are in the field and the faster you're back in production, the better it is. So the Chinese understood that. They shut down their factories. They understood that they needed to take the hit. They did everything they could to contain the disease, and the model was a forced quarantine for everyone. But they are back at 90% production, according to McKinsey. They are back to 90% production in the beginning of the month of March, after a nearly 10-week, well, actually I would say an 8-week containment period. So understanding that there are different measures to be taken at different times, and those measures would actually not only allow you to do business, but also allow you to do business once the wave has gone by. And then understanding as well that there's going to be a second, maybe a third wave. And so travel, if I can set expectations right now, travel won't be international right away. It will be domestic, and then it will be regional, and then it will be international. Why? For the very simple reason that there's going to be a lot of travel restrictions, and that there will be possibly some very severe measures that are going to be put in place to avoid having too much of a second wave. Look at China right now. Now that they have less than 100 cases per day, most of the cases are imported. They've implemented a 14-day mandatory containment period or self-quarantine period at the patient's expense, or at the person's expense. So you can understand it will have an impact, but of course, if you need to go do business with China, well, those 14 days, well, you accept them. It's part of the game, and you find someone who's willing to take 14 days self-containment, and who is reasonably sure that he or she will not be infected. Next slide, please. So what is the best response practices? And actually, when you look at the best response, the first thing I would say is look at the WHO website. So basically, they've set up the best response for a country, but then you need to start looking at the best response for your company and for companies working. And it's very important to understand that the first thing and the most important is education. So education will, and this is something I completely, I cannot underline how much over the past 2.5, almost 3 months, how many insane things I've heard, and the fear mongering, etc., it doesn't really make sense. So the first thing you need to do is educate your workers, educate them about good hand washing practices, the importance of social distancing, understanding that not everyone is going to be so fundamentally sick that they're going to die, understanding that your healthcare system, understanding where you are and the healthcare system that you're in, and the limitations that they have, but also the qualities that they have, because every single healthcare system is doing the best to cope with it, even countries that don't necessarily want to, because ultimately healthcare systems are manned by doctors and nurses, and doctors and nurses, I think, do the best they can for their patients. Understanding, of course, that it is important to implement strong and robust cleaning practices, but of course, if you look on the WHO website, and the coronavirus, sorry, is not necessarily a very robust virus, but it is important to note that good cleaning measures start with cleaning your hands, but then also cleaning surfaces, etc., etc. Understanding that if you have a case within your company, you need to implement something that is robust as well, and for that I would really advise looking at the WHO website, but also having a healthcare professional advising you, and then understanding as well that there are going to be other considerations. So contact tracing, and then screening, as well as return to work. Contact tracing is very important because it allows you to understand who might possibly be sick next. And when we look at the virus, and we look at when we look at the virus in patient secretions, clearly the virus is present 1 to 2 days in advance. And it is something that we need to take into consideration. So when whole companies close because they had one employee, and that employee was in contact with everyone for 14 days, it doesn't really make sense. It needs to be based on something that is valid and factual. And then return to work. So you will have employees that will be sick, and those employees are actually very valuable employees, because once they are sick, they've acquired an immunity, and reinfection is something that is pretty marginal. So young employees that have been infected can return to work, and actually will be in a situation where they will be where they will be resistant, and they could be an asset for the company. And I think it's very important to understand that there are return to work considerations. If you look on the ECDC website and the WHO website, they basically say, how many days after the initial symptoms should that employee return to work, or after actually the resolution of the symptoms. And then finally, screening. When you look at screening, it's important to understand that it's a site screening, but you can also screen for general health, knowing that people that have non-communicable diseases like hypertension or diabetes, if they are well managed, they have a better chance of survival if they get infected or not. Next slide, please. I think this was the last one. I'm happy to take any questions. I have a few minutes.
We're going to now go to another speaker, because the problem that we have is also time. Laurent, if you don't mind, I know that you have to leave, but we'll capture the questions that we have for you, and we'll make you know them so that you can answer that in a digital means, even if it's later. That would be great.
Okay.
Otherwise,
we're very much
with other speakers. Thank you so much for your great contribution. I think it has been very helpful and also very didactic in terms of how you have to manage as a company the risks. And many of our members, especially also in developing economies, will appreciate very much these insights. Okay.
I'm looking forward to all your questions. Thank you very, very much.
That's you. And Joaquin, we know well you and your work in the ILO. I don't have to introduce yourself. You have in the different remarks related to this event his background. But the most important thing is that he is chief of labor administration, labor inspection, and health and safety branch in ILO. I mean, we are working with them on a daily basis. But what can we do better in order to strengthen the private sector engagement regarding these emergencies, regarding also any coming pandemic, if there is other pandemic coming? I mean, at the end of the day, there must be some lessons that we have to learn, isn't it? The floor is yours. If you can be possible, we would thank you. Of course, have your time to present, but just to allow the interaction of participants here. Thank you so much.
Sure, of course, and I'll try to be as brief as possible. So thank you and good afternoon to all. First of all, buenas tardes. So I'd like to stress, first of all, that, of course, I mean, as I'm talking on behalf of the ILO and being the ILO a tripartite organization, I'll have to start by saying that, of course, the private sector and employers have a fundamental role, you know, in terms of addressing health emergency situations like, you know, the one that we are living now with the COVID-19. And they have a fundamental role, I mean, in many, many different fronts. I mean, as almost all of the colleagues that have spoken have stressed, I mean, the workplace is a very important role for communication. The workplace is a fundamental place for workers to obtain reliable information on how to prevent infection, on how to avoid, you know, spreading the infection to their families, to their communities. And this in particular in the sectors that are more at risk. But also, of course, it's at the workplace level that we can take immediate measures in terms of preventing and containing the infection, and having, of course, our emergency and preparedness plans. Again, throughout my presentation, I'll stress very much the role not only of employers and employers organizations more at policy level, but very much at practical level, at enterprise level. And here I'd like to stress, you know, how important it is, you know, the role of occupational health services. And this is something that sometimes we tend to forget a bit. And I mean, in my experience working in the ILO and working in many countries, and I'd say I'm mostly in a developing context, sometimes, you know, where, you know, national systems of occupational safety and health fail is that because we don't have, you know, adequate occupational health services, either being provided by the state or being provided by the private sector. So as you know, I mean, we have many different forms for these services to exist. I mean, they can be provided by the enterprise itself. This can be services provided to the market. They can also be provided by employers, organizations, and these are really the services, you know, that will have the expertise to assist the you know, business to continuously assess the risks that they have.
Sorry, Maria, can you mute yourself, please?
I think there is a problem with the mic. Can you? I think
Marina, I think it's Maria. Now it's okay.
Okay, so just to stress the importance of occupational health services, but also how important it is for these services. I mean, as they have the expertise on, you know, occupational safety and health management, also to liaise with the public health authorities. And it's also, they also have a very important role in terms of disseminating information at workplace level. So starting now with the first slide. Well, it's never too much to stress again that for any national policy, any national strategy, any national guidelines to address health emergency situations, communicable diseases, and now COVID-19, it is essential to have on board employers and workers organizations. They know the workplaces. They are the ones that know best the different industries and sectors. So it's very important that for any coordinated action plan that may exist in countries, we don't have only the cooperation between the ministries, you know, in charge of labor, in charge of health, in charge of the different sectors, but also, of course, the social partners, also, of course, the employers and the workers or organizations. It's also quite important to say that, again, the occupational health services here, you know, have a quite important role to play, because it's also at national level that these services, you know, should be heard on how do they see that the question being addressed from a safety and health perspective, you know, should be really addressed, you know, considering the specificities of the different sectors. So moving to the second slide, please, Marina. Okay. Okay, very well. Again, I'd like to stress that, you know, we are living in a situation of, well, where we have, you know, a certain uncertainty. because we don't know exactly, how the situation will evolve in weeks and months to come. And we know that many companies, well, at least in some countries, are still operating. We know that, even in countries hugely affected by the crisis, many enterprises are operating because they are providing services to the community. I mean, we have, of course, we have the health sector, but we have also, transport, services, dealing with, the provision of food, etc. And we also have services or businesses that have evolved already into a situation where they had to be creative enough to have different forms of organizing work. And these forms of organizing work, in most of the cases, consist of telework arrangements, but not necessarily. And again, it's very important for us because the question on when should we close down the business, etc. Of course, that this will depend on national guidance from national authorities. But again, it depends also very much at enterprise level on the assessment that we do of the situation, but also the assessment that we have on how the situation may evolve in our company. And if we see that the situation may evolve in our company in a way that we will have to reorganize work, we would need exactly to assess what are the risks that are associated with this evolving forms of operation, because for every different form of organization we will have risks. Of course, we will have to tackle the immediate risks that deal with prevention of infection of our workers and their families and communities. But also we have to address the more mid to long term risk, as many of you have already said, of mental health issues. I mean, and not only mental health issues, but also all that relates to the fact that we have many of our workers, and I speak for myself now, and I think that for many of you as well as employers, working from home. And just to give you my example, I'm working from home for 10 days now, and I used to work from home, but not for this extension of time. And I just realized yesterday that I don't have a single ergonomic chair at my place, and I started to have back pain yesterday. So I had to go to the internet and order an ergonomic chair. I started also to get, let's say, not serious disruptions in terms of the way I work, but I started to get the feeling of isolation, because it's not only the fact that you're working in a place that was never conceived to be a workplace, but it's also the fact that you are contained at your home. Well, you are forced to be at your home, you're not at your home voluntarily. So I think that this, on the mid to long term, is something that we, well, as employers, as workers, as governments, and as international organizations, will also have to address. Then again, I would say that moving to the next slide, that we have also to think of all the businesses that are operating, and I know that some of you have already addressed this topic, in the informal economy and in the most vulnerable economic conditions. And here we also have to consider that, as Maria mentioned, that in many countries, well, business continues as usual. Well, in some countries at least, if there are no reported cases, or if there are at least no known cases of infection. And then again, I attended a webinar this morning that brought some examples from India, etc. And then when you think of all the preventive or control measures being advised by the WHO on physical distancing, hygiene, etc., you start thinking to yourself, well, when you are in an informal family business, working in or operating in India or Bangladesh or in any other developing country, where the workplace is your home at the same time, and you have a family of 5 that all share the same room, and if you don't have in some, situations even running water, so how are you going to adopt these preventive measures? So again, I tried to very briefly put on this slide what I think that are the different solutions in terms of safety and health that would be required for enterprises, in different levels that may evolve, they may change over time when facing this pandemic. And again, when you look at the last one on informal economy, that's where, I think that, a mass effort in terms of awareness raising and still in terms of preventive measures is required, of course, along with, public health responses. So again, the idea I wanted to share, with this slide is just the fact that it is true that, prevention nowadays, preventing infection, it's something that we still have to consider, mostly for companies that are still operating, and namely, again, the risk sectors, health, occupations in direct contact with the public, etc. But also that, we have to consider the safety and health of our workers that have moved to different work arrangements, and this is quite important because I do think, and at least individually, I do consider that this will have long-term effects. So in terms of action at workplace level, I'm not going to refer to any of the recommended preventive or control measures because WHO has done this already very, very well. But I'd say that it's quite important for enterprises to keep aware and updated on any guidance being provided by national authorities. And when I say guidance by national authorities, is guidance on occupational health measures, but also on programs that will assist with the resilience of the enterprises themselves. Then again, it's quite important to train all of our workers on prevention and mitigation measures, not only the workers that are still as workers exposed to the risk of infection, but also our workers to the best that we can, of course, because I also understand the struggle that many companies are going through. So train our workers on how can they prevent negative mental health effects when they are living, as all of us, under the situation of uncertainty and working from home with their families, etc., etc., etc. So again, in terms of coordination,
the point related to working from home is essential. I think it's something that we have discussed, and we can further consider that. If may I ask you to speed up a little bit your presentation? Sure. We are running out of time, so if you can,
okay.
Thank you.
Sure. So I just want to refer then, again, to the need also at workplace level to involve workers on, the discussion and implementation of safety and health measures. Either this being, for companies still operating more or less regularly, and for companies that have already adopted different work practices. And then I'd move to the last slide, please. Just on what the ILO is doing. So the ILO, you can find information on, ILO's action on COVID-19 on a dedicated web page. You'll find the link on my first slide. Just to refer very briefly again that, we are working, let's say, in 3 different fronts. One is on protection of workers, and there's where you find, all the reference to safety and health, but also on, a key pillar on stimulating the economy and labor demand, and another one on support to employment and income. When it comes to safety and health, I just have the reference there, to our international labor standards, because these, for a normal situation or for a situation of crisis, they do provide, legal references that are applicable, namely in terms of on how to develop national policies and programs, but also workplace action that, can address any emergency in terms of safety and health. Also, of course, our guidelines from 2001 on management of safety and health at workplace level, and being more specific now, what we are doing now, in terms of COVID-19. So we shifted, the topic for Safe Day this year. So Safe Day, it's the World Day on Safety and Health at Work that we celebrate every 20th of April, exactly on communicable diseases, and in particular COVID-19. So we will have a couple of awareness raising materials. And we'll also have some very easy to use tools. They are targeting mostly, SMEs. One example is what we call, the COVID-19 checkpoints, which is, let's say, a kind of an annotated checklist that can be used by employers, to assess the risk that they may have of infection.
That's fantastic. And these checkpoints can be very helpful for many of our members. Juan Carlos, I think that we can link that as one of the main immediate contributions that the ILO is doing. May I just, because there's some questions already been raised regarding your presentation, if we can now, if you can, with your permission, move to another speaker, that would be great. Is that okay for you?
Yes, of course. Go ahead.
Thank you so much. We have Fernando Alvear. Fernando Alvear is a big friend of IOE Secretariat, but also an important member for IOE, the Executive Director of the Chambers of Production and Commerce in Chile. And is just because of one of these exchanges that we learned that they have just been very active setting up a fund precisely to help public authorities on the health area. I mean, precisely on hospital, etc. If he can elaborate briefly, Fernando, and I asked this to you yesterday night, to be very precise, at 11 o'clock in the evening. So if you just can provide a very quick insight of what you are working with several sectors in order to help the public health sector before it's too late now in Chile. Thank you so much.
Thank you very much. I say good morning because here we still are in the morning, and good afternoon for all of you. I hope that you're hearing me well. I don't have returns, so I don't know.
Perfectly.
Oh, good. Thank you. Well, since this began, now I'm completing my second week working from my home, a very new experience. I had been before some hours working here, but it's very different to be the whole day long in your house. So something very new and very different, no doubt. Right now in Chile, we have 1,306 cases and 4 people have died. This has been moving upwards, so new measures have been taken by government. Since Monday this week, there's a curfew that begins at 10 at night here in the city. And since tomorrow, almost a quarter of the total population of Santiago, we have around 6 million people, will not be able to move from their houses for a period of 7 days. We will all have to stay in our homes because in this sector, in these sectors of the city, there have been more focuses of coronavirus. So in that environment, we began first working with our different companies and our branches in order to set a number of all the workers of the different sectors could follow in order to protect our workers. And that is something that we finished, and now we have a number of protocols that have been set up for the mining sector, for different types of sector, and which we have them in our webpage. So that is a first thing that we began doing. But after that, we realized that that was not enough. And the idea of doing something else for the whole country began to spread between the business community. And that is why yesterday we launched a fund. It's an emergency private fund, and it's meant to complement what the government is doing in health. So it's an emergency fund for health. That is really the name we have given it, because what we think is that we are gathering money. Up to now, we began this fund with $34 million, and we aim to reach 34 million Chilean pesos, sorry, $40 million, and we hope to, and our goal is to get to 60 million in the next few days. And what we hope to do with this money is to take actions in different health sectors, doing it and coordinated with the national authorities. they know better where the priorities are. So we will work together with them in order to give help in some sectors. One of the ideas that we have is to increase heavily the tests that people can take in order to see if they already are having or could have a coronavirus. We hope to do this through the facilities and hospitals that the private sector manages through the law that gives us that responsibility for the working in order to prevent and take care of the accidents that take place in work. Almost all the private sector workers are enrolled in these companies, and those companies attend the accidents that the Chilean workers can suffer. And so through that channel, we hope to inject money, be able to buy more tests and do it more quickly in order to be able to have a first work being done in order to prevent and to know who are the infected people. That is one thing. And now we are meeting today, this afternoon, with the Ministry of Health in order to see what are the priorities that the government already has been settled, so we can move our help in that direction. We have also been in touch with the workers' organizations in order to receive their suggestions in order where we can help. So we are in the beginning of this effort, but we think that it is a very important effort, and we hope that all our workers and their families can really take care, and we are willing to help them in the most important ways that we can think of. I would say that that is where we stay today, and I'm very glad to share my experience. But it's a beginning. We're just in the beginning right now, Roberto. So I'm not in the position to give more details right now.
Well, just you to know, before I forget, we have a platform where we, as many others, but we are gathering the information that of what our business organizations are doing, but also what countries are doing. And we are trying to digest it and to give it a kind of qualitative analysis. We are putting that in the platform of IOE. And this is a very, I mean, many others are already starting also in the same direction, because that's also an investment for the private sector. And what we are doing is really anticipated in a very intelligent manner. So congratulations to you. So before also I forget, some people are already requesting whether the presentations will be available. I mean, as always we do it with this digital conference, we have it registered, put at the disposal of participants and also of our members, and also the presentations themselves. I had several questions in the pipeline. One of them was related to international SOS. It was, I think, Gabriela, but it also can apply perhaps to the WHO, because you referred, and Gabriela is from the USAID. USAID is our members in the USA, and she refers to authoritative information on immunity post-infection, success information. So I think that's something that perhaps, I don't know whether we can find this authoritative information. It would be very interesting, very important to know whether the WHO also have some insight. I think that we have also not just Maria, but also Ivan, who already also participate also with us in another digital conference in these days, who perhaps can provide some information on that. A second question was regarding also South Asia, because sometimes we look at the countries that are coming, specifically in the Latin American, in the Americas, and also in Africa, but we sometimes forget that also there are still important risks in Asia, and in South Asia. So we have the Director General of the Employers Organization of Bangladesh also joining us, who is asking whether there is any foreseen scenario for this South Asia region, which is also quite important because also they have elements of weak institutions, big informality, etc. So if any of you in the WHO especially and ILO can provide any insights on how you are cooperating or how you are seeing the scenario there, that would be great. We also have the questions of supply chains, and beyond the economic disruption, we already discussed economic disruption, is how can we as private sector do better to help the health authorities to have the basic needs that are needed. I mean, Fernando referred to the initiative that they have taken precisely to put some funds, but beyond the funds, sometimes is the resources. I mean, how we as business organization can help also to anticipate that further. I don't know if with these 3 questions, I don't know if I'm forgetting anyone, but well, we'll have perhaps some more time for other questions, but if not, we'll sum up with this. So I don't know if Maria, Joaquim, or any, I mean, even Fernando can reply to any of these questions. The floor is yours.
Thank you. This is Maria. Maybe I will try quickly on the supply chain. Not only there is a solidarity fund that you might consider to contribute to that, but I think again that the private sector can contribute to maybe switch on their production of certain items to try to contribute to what the countries are needed at the moment. So maybe in that sense, discussing with the national authorities, the ones that are coordinating the response to the emergency will be very good. We have already experiences of certain textile industry that is now contributing to do masks or things like that. So I'm sure that this will be very much appreciated as well. Plus, as I say, WHO has this solidarity fund, which is trying to look at kind of coordination of a supply chain at the global level to support those countries who are most on the difficulty. Regarding the immunity, yes, there is since the virus is new, we are still collecting information and we are missing a lot of information. In principle, yes, the virus will create or provide some immunity, but we are now collecting we have serological information and we are now looking at the immunity. But in principle, yes, the most probable is that after being cured or recovered, you will develop an immunity. We don't know for how long, but definitely this will be something important to look at. And yeah, I think those were most of the questions for us. I don't know whether Ivan or others would like to contribute on this. Over.
Yes, the floor is also yours, Ivan or Joaquim, if you have anything to say on that.
So not necessarily on this, but you know, as there was a question on precisely actually in South Asia, and I would say that this also relates to other regions. I mean, we've been working very much, in direct assistance to constituents and to employers, namely, and basically, most of the requests for assistance we are receiving is exactly on, risk assessment at workplace level and how to put in practice, emergency and preparedness plans, but also very much, questions related to absence of workers and if, infection with COVID can be, is an occupational disease or not. And so this is very much, I'd say that it's very much direct assistance to enterprises that we are doing, either directly also or through other services of the ILO, such as better work for the ready-made garment sector, for instance.
Final 2 questions, and one of them, I mean, both of them are very interesting. One of them is from our friends from Rwanda in Africa, and they say that mobile penetration of the virus is quite high in Africa and in Rwanda, but unfortunately not the healthcare system is up to the expectations at the same part of developed countries. And he's asking, do you think that enhancing a remote self-testing plan would positively contribute to the epidemic preparedness and control? And also it's related to one of the tools that ILO has put into place. Then we have another question to our friend from Chile, from Jose Manuel Salazar. Apart from congratulating for the initiative, the fund will be used only for testing of the workers in companies, or goes beyond that? I think it's beyond that. I think you explained that it's also for helping the health systems, but you just clarified that. I will go perhaps to the first question. I don't know if our friends from WHO can answer that, or from ILO.
So from my side, if I understood correctly, the question was on the practical tool that we are currently developing.
Yes, it's related to that because yes, it's to.
Okay. So we have, okay. So as you know, we have to act very quickly. I mean, we hope that the tool will be available like probably next week in the 3 official languages. And again, it's a tool that looks well. It tends very much, to assist, especially smaller employers, as I said, to assess the risks they have in the workplaces. In terms of, again, potential exposure of workers, but also in terms of, reorganizing the work, in terms of avoiding, or promoting physical distancing, etc., etc., etc. So this will be available on our website. I'll be happy to inform you, as soon as it's there, so that you can also share, with your associates, with your members.
Okay. Fernando, can you answer the question related to the fund in Chile?
Of course. Could you just repeat who made the question, Roberto? Because I think it's somebody.
Jose Manuel Salazar. Jose Manuel Salazar. You know him well.
Yes, Jose Manuel. Nice to say hello to you. My regards to you. Take care. We are just thinking in beginning to use these funds in weather tests, but of course we think to do other activities too. So that is why we have this meeting today with the Minister of Health, in order to see the priorities that the government has already settled, so we can be able to already direct some of the funds in order to attend those priorities. Thank you.
Gracias, Fernando. Mucho gusto.
Gusto de oírte, querido amigo. Un gran abrazo.
Okay.
Igualmente, fuerte abrazo. Hasta luego.
Okay, we turn in Spanish a little bit. Well, yes, I want to say thank you to all of you. Thank you to the panelists. Thank you, Maria. Thank you, Joaquin. Our friend from International ISO is not here, but of course, thank you to him. And of course, what beyond the exchange that we have, what we want is to have action, an action in a critical moment for the world itself, for the world of business, for the work. So we are looking forward to collaborate further with all of you, with your institutions, with innovative and efficient partnerships. Please join, all the material will be available to all of you, and please follow up and keep safe. That's also very important for all of us in these critical moments. Thank you for joining. I think it has been an extraordinary exchange. We have more than 70 participants, which also says a lot about the interest of this topic. Thank you so much to all of you.
Thank you. Bye.
Thank you. Bye-bye. Thank you.